Welcome to Ortho Reports. Today, we're going to dive into a real medical mystery, one that comes straight from the Journal of Orthopaedic case reports. It all starts with a problem that doctors see all the time, but the real cause? Well, the cause was anything but typical.
So, what happens when a classic presentation leads you down completely the wrong path? This case is the perfect example of that. It's like a medical masquerade. You've got this painful, swollen joint in a little kid, all the alarm bells are ringing for an emergency, but the real culprit? It's hiding in plain sight.
All right, so here's our patient. He's a 4-year-old boy, totally healthy up until this point, and he's brought in with a situation that would freak out any parent. His knee is acutely swollen, it's painful, he's running a fever, and it's just getting worse. And there was no fall, no injury, nothing. Just this rapidly developing problem that needed answers, and fast.
Based on the symptoms, the medical team's #1 suspect was septic arthritis. And look, this is not a diagnosis you take lightly. We're talking about a bacterial infection inside a joint that can destroy cartilage and cause permanent disability in a matter of hours or days. The clock was absolutely ticking.
With septic arthritis as the prime suspect, the team had to move fast. They started gathering all the clues they could: physical exams, imaging, blood work, to confirm what they thought was going on and justify an emergency surgery.
And at first, all the evidence seemed to line up perfectly. The boy's knee was warm and swollen, he was in a lot of pain when they tried to move it, and he had a fever. Even the x-ray, while it didn't show any bone damage, confirmed there was a big problem, pointing to soft tissue expansion and fluid in the joint. I mean, it was a textbook presentation.
But then came the first wrench in the works. While the physical exam was basically screaming infection, the lab results started telling a very different and much more confusing story.
The results were just contradictory. His total white blood cell count was high, which, fits with an infection. But then you look at his C-reactive protein, or CRP, and it's normal. Now, CRP is a key marker for inflammation, and in a case of septic arthritis, you would expect it to be sky high. And then there was this other oddity. 29% of his white blood cells were a specific type called eosinophils, a drastically elevated number that usually points toward an allergic reaction or maybe a parasitic infection, not bacteria.
So this was the huge question facing the doctors. The clinical signs were pointing to an emergency, but the blood work just didn't add up. How could there be a raging infection inside that joint without a major inflammatory signal showing up in the blood?
You know, despite those conflicting lab results, the risk of letting a potential septic joint go untreated was just too great. A decision had to be made to intervene directly.
So, they took the patient for an emergency arthrotomy. This is a surgical procedure where they actually open up the joint to wash out any infection and relieve all that pressure. It was really the safest bet, given how severe his symptoms were. They were fully expecting to find pus.
But inside the knee, they found this reddish, watery fluid, not the thick pus you'd see with a bacterial infection. They sent this fluid off to the lab for analysis, expecting to finally grow the bacteria responsible. But the results that came back, they were stunning.
Nothing. The culture was completely clean. The prime suspect, bacteria, was officially cleared. This boy did not have septic arthritis. So, what on earth was causing this violent inflammation in his knee? The answer was in the fluid itself. A staggering 62% of the white blood cells they found inside the joint were eosinophils, the very same cells that were unusually high in his blood. This wasn't a bacterial infection, it was an eosinophil invasion.
So with this new evidence, the real diagnosis finally snapped into focus, and it revealed a rare condition that perfectly explained the entire puzzling clinical picture.
The boy was suffering from Eosinophilic Synovitis. This is an incredibly rare condition where the body, for some reason, just sends a massive army of eosinophils to the lining of a joint, the synovium. This flood of cells causes it to become intensely inflamed, swollen, and painful, perfectly mimicking septic arthritis.
And this just brilliantly illustrates the diagnostic trap they were in. While the symptoms are nearly identical, the cause, and more importantly, the treatment are worlds apart. One needs urgent surgery and antibiotics, while the other requires a completely different kind of medication.
So what causes this eosinophil flood? Well, it can be triggered by allergies, parasites, or even a reaction to a drug. But in a lot of cases, including this little boy's, doctors just can't find a specific trigger. It's what they call idiopathic, which basically means the cause remains a mystery.
So once they had the correct diagnosis, the path to recovery was actually pretty straightforward, and the case provided a really critical lesson for all clinicians out there.
With the diagnosis confirmed by looking at the joint tissue under a microscope, the treatment plan shifted dramatically. So instead of those powerful IV antibiotics, the boy was given a 3-week course of an oral antiparasitic drug called DEC, which is known to be effective against these kinds of eosinophilic conditions.
And the result? It was a complete success. The inflammation just vanished. His blood work went back to normal, and he regained a full range of motion in his knee. The problem was solved, with no lingering effects at all.
The authors of the case report really emphasize that this rare condition has to be on the radar for any doctor evaluating a swollen joint in a child. Recognizing those confusing clues, like a normal CRP but really high eosinophils, can help point to the right diagnosis much earlier and potentially avoid an unnecessary surgery.
And that really leaves us with a fascinating question that goes way beyond just this one case. It's a great reminder that in medicine, and maybe elsewhere, when the evidence seems contradictory, the truth might not be just a variation of what you expect. It might be something else entirely, a medical masquerader that you have to be clever enough to unmask. Thanks for joining us on Ortho Reports.